I am Dr. Sharjeel and you are watching my YouTube channel. If you like my videos, don't forget to subscribe the channel at the end of the video. Now today I am presenting you a very interesting case of a vitreous wick syndrome, which is also known as vitreous tug syndrome or vitreous touch syndrome. This patient had a camp surgery and posterior capsular rupture occurred, and the surgeon tried to put foldable IOL, and which also dropped posteriorly, and then the case was closed in a hurry. When I examined the patient, there was a pupil peak, decrease of vision, painful eye with cystoid macular edema, and IOL at 6 o'clock inferiorly. And on slit lamp examination, there was a vitreous band coming from the pupil, causing pupil peak and running through anterior chamber straight into the main port, causing vitreous wick syndrome. So after a complicated cataract surgery or after trauma to the eye, a vitreous wick syndrome can occur when the vitreous find its way into the anterior chamber, and then it moves up till corneal wound and causes the breakdown of the corneal wound, and there is a prolapse of vitreous as a vitreous wick, and there is high risk of infection and ophthalmitis because the AC is not sealed. So what's the management of the vitreous wick syndrome? The management of the vitreous wick syndrome is that first, if there is a very mild vitreous wick, you can give pilocarpine drops that can constrict the pupil and highlight the vitreous wick, and then with the YAG laser vitreolysis you can cut the vitreous band, release the traction, and solve the case. In my case, the patient was aphakic, so I had to treat it surgically. The other method is a surgical method. With dilated examination, there was a support for rigid IOL. So what I did, I surgically cut the vitreous with a cutter, and then removed the foldable IOL that was at 6 o'clock, and ironically, when I was performing anterior vitrectomy, due to gush of water, as there was a clear communication between the anterior and posterior chamber, the IOL moved up and it was just behind the posterior capsule. So I gently removed it through main wound, the foldable IOL, and implanted the rigid IOL in the sulcus, did anterior vitrectomy and closed the wound. So these are the means of treating vitreous wick syndrome. Thank you.